Being a nurse, we all know that patients get super comfortable with us, right? So you walk into a patient's room, literally within, like, I'd say within 30 minutes, you get to see this patient naked, right? So the boundaries of nurse-patient, communication is, there's not much, right? So we really get right into there. We talk about their most private things. We talk about suicidal ideation. We talk about their sexual history. We talk about the drugs they use. So obviously, a lot of these patients are going to be like, I can tell this nurse anything. But wait, this patient, I'm happy he told this nurse this because he got convicted and, he's in jail right now. But this patient felt comfortable enough with his nurse where he told her that he committed a murder. How? Why would you do such a thing? Why would you commit a murder and then confess it to the nurse? It's because nurses are just that kind of profession where you feel like you can say these things. But understand, we are mandatory reporters. If you tell us anything that puts yourself in harm or other people in harm, or if you've harmed other people or you've harmed yourself, we are mandated to report this. So as open as we are, as much information as we want from you, understand we have to report what we have to report. So let me tell you about this story. A jury found a man guilty after he confessed to murder on his hospital bed. Thursday, Frank Frometa was convicted of killing Wilfred Salas. Salas's body was found in a road in 2016 and no one knew what happened. No one knew who killed him. It was just his body was there. We didn't know what happened. He told a nurse he killed someone a few months back and wanted to clear his conscience. Frometa says he killed Salas in self-defense after the two argued and Salas pulled out a knife. His sentencing is scheduled for July. He faces 34 years behind bars. Understand something. I hear a lot of people always talk about self-defense, self-defense, self-defense. But a true self-defense situation is, yeah, you lose your mind, you're in a fight, someone punches you, you punch them back, even if you use deadly force, whatever the situation is. But if it is self-defense, and if it's not premeditated, and if you're not a crazy son of a bitch, I know you're scared of the consequences, but you need to report it when it happens. You need to say, holy shit, we're in a fight, look at the scars that happened to me, I didn't mean to kill him, but it was an accident. After he fought, I fought, we fought, and then someone died. That is what you call self-defense, because then you pick up the phone right away and you say, 911, I was in this fight, this person died, and you go through the process. But that's not the point of the story. The point of the story is, yes, tell your nurses everything and all you want, but understand we are mandatory reporters. We have to tell the higher-ups, we have to call the law enforcement, we have to do what we have to do to keep you and the community safe. So if you're going around committing murders, don't go to a hospital and tell a nurse. Actually, go ahead and tell the nurse, because we want you off the streets.